Welcome to this short lesson on pulse oximetry, one of the quickest and most useful measurements you will take at the bedside. Pulse oximeter is the small clip, usually placed on a fingertip, that gives you two numbers in seconds. The first is the oxygen saturation, written as SpO2 and shown as a percentage, which tells you how much the patient's hemoglobin is carrying oxygen. The second is the pulse rate. Because it's fast, painless, non-invasive, oxygen saturation is sometimes called the fifth vital sign, taking its place alongside temperature, pulse, respirations, and blood pressure. In the next few minutes, we will cover three things. First, what pulse oximetry actually measures and how the device works. Second, how to take an accurate reading step by step. And third, the everyday factors that can throw the numbers off so you know when to trust it and when to look closer. Keep one idea in mind from the start. The oximeter gives you an estimate, a very useful estimate, but it's still an estimate. Your job is to get the cleanest reading you can and then read it together with how the patient looks and feels. Let's begin with what the number actually represents. So what is pulse oximetry actually measuring? The number, SpO2, is the percentage of hemoglobin in the blood that is carrying oxygen. Hemoglobin is the protein in red blood cells that picks up oxygen in the lungs and delivers it to the tissues. If nearly all of it is loaded with oxygen, the saturation is high. Here's how the device figures out that number without a needle. The sensor has two tiny lights, one red and one infrared on one side, and a detector on the other side. Oxygen-rich blood and oxygen-poor blood absorb these two colors of light differently. The oximeter shines both lights through a thin, well-supplied area such as a fingertip, an earlobe, or a toe, and measures how much of each color comes through. Importantly, it only pays attention to the part of the signal that pulses with each heartbeat, because that pulsing part is the arterial blood we care about. This is why you sometimes hear the phrase no pulse oximetry. From that comparison, the device calculates the saturation and also counts the pulse rate. For most healthy people, the saturation reads between 95 and 100%. It can run lower in people with heart or lung conditions and slightly lower at high altitude. Now let's take a good reading step by step. First, choose and prepare the site. A fingertip is the most common. Make sure the area is clean and dry, and if the patient is wearing dark nail polish or artificial nails on that finger, remove it or pick a different site, because it can block the light. Second, check perfusion. If the hand is cold, warm it, since poor circulation weakens the signal. Third, place the probe so the light source on top lines up directly across from the detector at the bottom, with the finger seated fully in the clip. Fourth, ask the patient to hold still and keep the sensor away from bright overhead or procedure lights. Fifth, wait for the reading to settle and look for a steady pulse signal or waveform on the device. Sixth, and this is the quality check many people skip, compare the pulse rate on the oximeter with the patient's actual pulse. If the two match, your signal is trustworthy. If they don't, the number may be unreliable. Finally, record the saturation, the pulse rate, and whether the patient was on room air or oxygen, because that context matters. Done carefully, the whole process takes well under a minute and gives you a number you can rely on. Now let's discuss what to do when the oxygen saturation drops below 90%, because this is the number that should get your attention. First, what it means. A saturation under 90% is called hypoxemia, which simply means the blood is not carrying enough oxygen to meet the body's needs. Our organs, especially the brain and the heart, depend on a steady supply of oxygen, and they are quick to suffer when it falls. The body tries to make up for the shortage by breathing faster and by speeding up the heart, so you may notice a rapid pulse and rapid breathing. You might also see warning signs such as bluish color in the lips or nail beds, shortness of breath, or new restlessness or confusion. As a medical assistant, your role is to recognize this and respond, not to diagnose or treat on your own. Stay with the patient and stay calm. Your very first move is to make sure the reading is real, because a cold finger, motion, or nail polish can give a falsely low number. Recheck the probe, warm and clean the finger, ask the patient to hold still, and confirm that the oximeter's pulse matches the patient's pulse. If the low reading holds, alert the provider or nurse right away. Do not wait. Help the patient sit upright and breathe slowly, and apply oxygen only if it is ordered or allowed under your office protocol, and you are trained to do so. Keep monitoring, reassure the patient, and document what you saw and did. Finally, know your red flags. Severe difficulty breathing, blue lips, confusion, chest pain, or a number that is very low or still falling means you activate your emergency protocol or call for help immediately. The reading is your early warning, so the faster you recognize it and escalate, the better the outcome for your patient. Now to summarize the key points of this lecture. Pulse oximetry is a fast, non-invasive way to estimate the oxygen saturation of the blood, the SpO2, along with the pulse rate. It works by shining red and infrared light through a pulsing site such as a fingertip and comparing how oxygen-rich and oxygen-poor blood absorb that light. For most healthy people, the saturation reads between 95 and 100%. To get a reliable number, prepare and warm the site, remove dark nail polish, position the probe so the light and the detector line up, keep the patient still and away from bright light, and confirm that the oximeter's pulse matches the actual patient's pulse. Remember the things that fool it, including poor circulation, motion, nail polish, bright light, carbon monoxide, which can falsely read high, and skin pigmentation, which can reduce accuracy. Above all, read the number in context. The oximeter supports your judgment. It does not replace it, so always consider how the patient looks and feels. Master these basics, and pulse oximetry becomes one of the most valuable quick checks in your clinical toolkit. The references for today's facts are listed at the bottom of the slide if you'd like to read further.